Okay, hi Carson. This is Dr. B, and I have in front of me your presentation, and I'll be making first look comments on it as we go. And there we go.
There's going to be 3 in total. 2 of them are going to be from France, and 1 of them is going to be from China. So the first French study.
Okay, a couple comments. It looks like you're filming the screen directly, which works, and that's fine. It looks like you have nice, professional looking slides, plenty of quotes here. It is bullet pointed. You sent me that email. I'm not too worried about it. And it looks like you're going to focus on some real, juicy data, just actual studies, and focus on the real detailed information. So I'm interested in this for hydroxychloroquine with or without azithromycin. So let's proceed.
To figure out was just the general effects of hydroxychloroquine, whether it was harmful or not, and whether it helped the coronavirus or not. And they did use something called azithromycin to help. They only used that for 6 of 20 patients, though. So the issue with this survey, with this study, is that they only had 36 patients, and this is bad because
It's insanely bad. It's almost not worth pointing out when you have that few patients. But people were desperate, so I think that's why they included it.
1, it's a very small sample, and 2, they were initially supposed to have 26 people to be treated with hydroxychloroquine. However, 6 people were pulled out, either because they could not stand the symptoms of hydroxychloroquine anymore, they needed to be moved to the ICU, or because they died. There weren't a lot of deaths. I think it was only 1 or 2, but that was not recorded in the final results. They kind of just discluded that, which is not very amazing. So the 20 cases treated with hydroxychloroquine were reported to have reduced viral carriage and lower average carrying duration, which is good, which means that the virus was diminishing and that they were not spreading it as much.
I understand. So proof of concept is demonstrated. That's good news. Tiny study. And humans, right? The people worldwide don't really care. They need a cure.
So the conclusion for this experiment, or this study, is that despite the small sample size, hydroxychloroquine treatment is very much so associated with viral load reduction and disappearance in COVID-19 patients, and its effect is reinforced by azithromycin.
Wonderful.
And here are the graphs. The first graph on the left shows the black line being the control group, so people who weren't given hydroxychloroquine, and the red line shows people who were given hydroxychloroquine. And the y-axis shows the percentage of patients with PCR positive samples. That's basically just saying people who were getting rid of the virus. So
2 things I like about this. You found some data that's super easy to analyze, super relevant, and you simplified this y-axis for people so it's clear that HCQ levels are, remdesivir, the coronavirus is working for people on HCQ. No doubt about it. Tiny study.
So the red line shows a better outcome. Less people had the virus over time, which shows that hydroxychloroquine was doing its job, according to this graph. In the second graph, you see a very similar trend, but then you see a third line, which shows hydrochloroquine and azithromycin, which seems to be the best result. It has the steepest decline, and in fact, 0% of the patients.
Okay, this is blockbuster territory right here. It's gone after 5 days when you take this combination treatment. Only 20 to 30 patients. I get it though. If this were me and I was seeing this, I'd be like giddy with excitement, you know. Now I know where this is going, but I just have to say that that piece of data is amazing. And I guess to cut to the chase, this might be showing the dangers of drawing conclusions from ridiculously small trials.
On day 6 still had the coronavirus. And so now the second French study. Again, the title's at the top, and they also use hydroxychloroquine and azithromycin.
Okay, 1,000 patients. Now you're talking.
However, this one's a little bit better. It uses 1,061 patients, which is much more than 36, and all of these patients received hydroxychloroquine. Of these patients, after receiving treatment, 973, or 91.7%, so a majority, had good clinical outcome and ended up getting
This
over
is exactly what I would do. I would test it with both since it was the most promising.
the virus and being essentially cured from the virus, which left 46 patients, only 4.3%, to have a poor outcome, and 8, less than 1%, ended up dying.
Hold on, there's something wrong here. I don't see a control study. 46 patients had a poor outcome. What is going on? There is nothing, there is no control whatsoever. How can you say maybe 95% would be fine with taking nothing at all without a control study? I'm very concerned, but let me listen here.
And the reason they died was mostly due to age, severity of illness at admission, and they just received less hydroxychloroquine than the other patients. In the conclusion of the study, again, hydrochloroquine and azithromycin, given before COVID-19 complications, is safe and is associated with very low fatality.
Given before the complications, that's when you'd want to take it. You know you have it, but it's early. They're saying it's safe and very low fatality rate. So that's the "what do you have to lose" quote, you know. So far what I'm seeing is it has potential, although this study's meaningless in terms of efficacy, and maybe it's relatively well tolerated. Interesting.
Rate in patients. This is generally just saying hydroxychloroquine will not hurt people if
Yeah, but is that true?
they take it. And here's a little image which shows how they chose their patients, sort of, or how they excluded them and got the numbers that they did. So they started with 1,411, ended up excluding 350.
And I believe this is all early stage.
For reasons such as they had allergies, or they didn't want to participate, or they had already been in other studies, leaving them 1,061 to be treated. 56 were asymptomatic, while 1,005 were symptomatic.
Wow.
And also 909 were in daycare hospital, while 152 patients were in conventional units. Just that's letting you know where they were, the setting of their treatment. And lastly, the Chinese.
I wonder where this is going. Let me take a peek at your data and see if I can predict what you'll be saying. Not a lot of students, patients. Did they get the azithromycin? It looks like no. So, you know, it was that azithromycin additive that seemed to be the most exciting one. Let's see, negative adverse effects did not result in probability of negative conversion than a standard of care alone. See, now they actually did a control here and said that it's not doing anything, which is, think about it, 30 patients, not enough to conclude anything, so just discount it, right? 1,000 patients, but no control. What's the point, right? The only thing you can say is it looks relatively safe. Now you're doing 150 patients, still on the low side and geographically isolated, right? And what you're finding is it's actually, on this scale, you're starting to see it's not doing any good, really, and it's doing a little more worse. So it's a great case study for students to evaluate.
Study. Again, the title's at the top. This one had 150 patients, so could be better, but not so bad. 75 were given hydroxychloroquine of these patients, and 75 were only given standard care, no hydroxychloroquine.
I really wish they included the azithromycin, don't you?
Of the 150, 148 had mild to moderate disease, which left 2 to have severe coronavirus disease. And in the end, 109 had negative conversion, which is to say that coronavirus it basically starts with SARS-CoV-2, and it then turns into COVID-19, much like how HIV develops into AIDS. So negative.
This I did not know. It starts out as CoV-2 and turns into COVID-19. I'm not sure I understand that, to tell you the truth.
Conversion is when that transition happens. So that's saying 109 patients ended up getting coronavirus before the 28-day period. And 53 of those people were treated with hydroxychloroquine, and 56 were not. And the overall takeaway from this study is that the chances of experiencing negative conversion was 85.4% likely in the hydroxychloroquine group, which is only 4.1% different from the control group. Basically, that's just telling us that there was not much of a difference with hydroxychloroquine.
That's really relevant. It's not doing much.
And in fact, more adverse events like diarrhea were recorded in hydroxychloroquine patients, so they suffered most from the symptoms. In conclusion, hydroxychloroquine did not result in...
You know, what I'm reading is that once you do a real study with a control and with enough patients, you're starting to see a big fat zero.
Significantly higher probability of negative conversion than standard of care alone in patients. Mainly persisted mild to moderate COVID-19 for all the patients, and adverse events were higher in hydroxychloroquine recipients. So this study is very much proving the fact that hydroxychloroquine might not be as beneficial as it is. While it does not cause harm to the patients, it wasn't really
And
helping
one
them.
thing you can guarantee from a scientist is they're always going to recommend more studies, which is where my mind is going. Number one, you need a large scale study with the azithromycin and with a control study, because that was the most promising data. And maybe that would actually show that there's something there. Next thing is you got to repeat a study just like this, clean HCQ study with a lot more than 150 patients, nice control, and get more robust results. And if you can show that it's not looking good, then that's relevant. And is this early? This is mild, moderate disease. I would test it for early and late and see if there's any point in giving it at any point in time.
Making much of a difference. And these graphs here represent that. So the graph on the left shows patients with positive SARS-CoV-2
Yeah,
PCR test,
Zippo
and you'll see that
and Zippo.
basically the trend is downward. So that's showing that over time, less people had SARS-CoV-2, which means it was developing into coronavirus 19. So over time, people were developing coronavirus. And you'll see that the purple line and the yellow line are very similar, which shows that there was not much of a difference between hydroxychloroquine patients and non-hydroxychloroquine patients.
Yeah, I'm hearing the same thing. And is that it? Yes. Okay, so hang on. So let me mention a couple things that I liked, a couple things you might want to do in the future, and your overall grade. A couple things that I like. My favorite thing is that you went in depth into 3 real studies, and they were presented chronologically, and the data that you presented was well supported with graphs. The graphs in particular made it very easy to understand. One thing that I think could have help the study, the presentation a lot would be if you summed it all up at the end. I don't believe you did so. It seems like you were worried about the time. I'm receiving, and that could be my fault, I'm receiving presentations as long as 10, 15 minutes. I don't really care if they went over because I enjoy watching these things. So keep that in mind in the future, unless you hear that whoever you're presenting this to wants you to absolutely limit it. You go ahead and go a little bit over because these things are really interesting. I don't think you had to increase your frame rate, for example, but a summary, which in my mind was that the first study was too small to be of any significance whatsoever. The second study showed great potential for the azithromycin. It was the first one that showed maybe the azithromycin taking it at the same time could be onto something, but my God, such a small study. The second one showed that it's maybe well tolerated, but without a control, you have no idea if it's doing better than nothing at all. And the third one, finally, somebody did a decent study, and they're showing something close to a big fat zero. I'm remembering something about maybe even another study that showed some deaths occurring where they had to cut things off, and now it's just dead in the water. Nobody should be taking hydroxychloroquine for this stuff. It's been demonstrated conclusively that it does more harm than good, and although there might be a little bit of something in a very small trial, you're always going to get a selection of results. The odds are that this thing is going to do less good than more harm, and therefore you shouldn't be taking it. In terms of your score, college level, absolutely 10 for 10. Inspiring, yep, 10 for 10. Fascinating, oh, absolutely 10 for 10. Not bullet point. I'm going to take 2 points off for that, one for the bullet points and one for the lack of a pull it together conclusion. The timing was good, and the final score is a 48 out of 50. Thank you, Carson, for that excellent presentation.